So national mirror groups, the concept of them, at least in the rare disease space, is that this is really a way to connect what's happening at national level with what's happening in these really big structures. So these pan-European structures, international structures set up for rare disease. So we're thinking about initiatives like the European Joint Programme for Rare Disease, ERDERA, so the European Rare Disease Research Alliance, the ERDERA, which is the International Rare Disease Research Consortium. All of these, quite big structures involving many, many partners. It can feel quite distant sometimes to people living with a rare condition on the ground, or people working in rare disease on the ground in our different countries. So the concept of a national mirror group is really twofold. It's on the one hand to try to bring together and kind of coalesce and hopefully amplify actually what is happening in rare disease in your country. And then the second goal is to really connect that, so form a kind of two-way bridge with these big international structures. Okay, so how do national mirror groups operate with ERDERA? So it's a little bit of a moving train at the moment. So through ERDERA, we are working to both increase the number of national mirror groups that we have, because we don't yet have them in all countries. So at the moment, as of beginning of October 2025, we have 80 national mirror groups have officially launched, but we have 37 countries in ERDERA, and the goal is to have national mirror groups for rare disease set up or badged, because these don't have to be brand new structures if you have something already, but we want to have a national mirror group officially operating for rare disease in all of those countries, or almost all of those countries. So we're working to build that capacity. At the same time, we're working to get those national mirror groups that are coming online, getting them to do all the things we want them to do. So on the one hand, we're asking them to come up with strategies for how they're going to bring together different rare disease actors in the national level. And we've already got some really good examples of how national mirror groups are adding impact here. So for example, my colleague Madara Auzenbaha is one of the co-leads for this work, and she actually coordinates the Latvian national mirror group. So they are really, I think, becoming the rare disease body in Latvia. So they have quite concrete responsibilities to kind of oversee and support the development of their next national plans in Latvia. So that's really important for rare conditions. In my country, in the UK, we actually have quite a lot of things at the cross rare disease level at the moment. So we have a lot of different structures, different funded projects. And so really the goal of our national mirror group is at the moment more about bringing those together, so that actually the UK space is not duplicating with itself, that everybody's pulling together in one direction. And then to really think about how and where we could add value to what we do in the UK by implementing some good practices deployed elsewhere. So a good example that we're asking all of our national mirror groups to think about is things like national infrastructure, national registries. Do you have these for rare disease? And if you do, are they working as effectively as they could be? So what would ERDERA data experts tell you to do in terms of setting up and evolving a national registry? What kind of data standards, what kind of terminologies, codification systems should you be using? How can you kind of solve the challenge of making real world electronic health record data more compatible for research and with research data? So it's trying to look at solutions from these big structures and really seeing how they apply to different national settings, because not every country is the same. And actually there's going to be no perfect one-size-fits-all that's going to work everywhere. So that's another goal of the national mirror group concept, is to help us not just get more alignment between ERDERA, etc. up here and the ground level in our countries, but also to see if we can put more countries in contact and foster some new collaborations between either countries of maybe similar size, because what works in Luxembourg might not be what works in France or what works in Australia. And also think about how we can support regional collaborations, because countries like the Nordic countries, they already have collaborations around rare disease. So actually, it might not always be meaningful for Norway or Sweden to work closely with every country in ERDERA. They might want to do quite a lot of their stuff more locally, more in their region. So it's about being adaptive to those different sorts of needs, really. So I think probably, having a national mirror group is going to be especially important for underrepresented countries. I think again, the example of Latvia is very, very meaningful here, because in countries where perhaps you haven't got, years and years of investment from your funders, perhaps you haven't got, huge multi-million data infrastructure set up for rare disease, there's actually a chance for those countries to kind of build that a bit more from scratch through the mirror groups. So I think in those countries, the mirror group role is particularly powerful, actually. And it's a chance to really, learn from other countries, not to say this is how these countries have achieved success, because actually sometimes the countries that went before wouldn't go the same way again. So, France, for example, I always talk about France. They have a national register for rare disease. We have one in the UK. If you were going to be building those from scratch today, you maybe wouldn't do it in quite the same way that you did. So I think that, the countries that are, maybe don't have so much infrastructure, so much investment today can really learn from that. I think there's also probably going to be a lot of potential there for fostering collaborations between the different types of countries. So underrepresented countries together, there are amazing practices that they can show us. Countries like Estonia have got fantastic, they're years ahead in terms of the digital health and e-health and data. So, I think underrepresented countries, can teach all of the countries something new, but also there's particular opportunities for impact there, I think. And we can think about organising, events on key topics for underrepresented countries as well, and thinking about what works for them, what additional needs they might have, what kind of joint topics would they like us to work on. So we have quite a few countries, and my colleague Clément Moreau from the coordination team is really the creator, I think, of this concept in the rare disease space. So he's been working on the National Mirror Group's concept for rare disease for quite a long time now. It started under the European Joint Programme. So as I said, we've got 18 countries have officially launched, and we have quite a few other countries in ERDERA, like Greece, like Luxembourg, which are kind of ready to go, and we know who the leads are going to be and how they're going to get going. So one challenge is that we're already trying to work with this kind of two-tier system where you have the officially launched NMGs, the mirror groups, and then you have this whole community of people who are likely going to be the leads. In a few of the ERDERA countries, we might not know yet who's going to step into that space and do that. So there are kind of bureaucratic and financial and administrative challenges we have to get around who can coordinate. I think, to be honest, one of our biggest challenges is getting the word out there, because most people, even in the wider rare disease space, unless you are really directly part of a national mirror group in your country, you probably haven't heard so much about this. So because we're at a point now where we've got pretty much half of the countries we expect to have NMGs have actually launched those, I think we can do some really great comms and promotions. So more of this, this kind of activity, and more interviews with the different national mirror groups to really see what they're doing and how they're working. And I think, the more that the mirror groups can work together and hear what each other's really focusing on, that will help. So in the UK, for example, one of our particular goals, as well as bringing together all the different strands of work happening in rare disease, is we really want to have a particular focus on how and where we might engage with European reference networks. And that kind of exposes, I think, the opportunity, but also some of the challenges of our national mirror group concept within ERDERA. So this isn't just about EU countries having a national mirror group. That's important, but ERDERA is more than just EU countries, and it's more than just European countries. So, although European reference networks are key structures for rare disease care and increasingly research in our EU member states, not all countries in ERDERA are participating in these. So 11 of the ERDERA countries are not EU member states. So in the UK, we once were very much involved in the ERN story. We're very committed to ERN. So we're trying to explore through our national mirror group how we might have some more formal collaboration still with the ERNs. That may not be such an issue for other countries, say for Canada or New Zealand, Australia, Morocco. But actually it may be very relevant to them to think about how they can network and form collaborations with other countries in their part of the globe as well. So it's really about finding, it's not a one-size-fits-all, but it's finding some core activity that we can all do. So we say, okay, national mirror groups as a set are going to do this, 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 and this. And then it's building on top of that to what works for your national setting. So one thing that we're working on in terms of trying to get some level, as I said, of kind of, core content between the national mirror groups is really looking at the membership, so who's involved in these. So the idea is that you as a national mirror group involve, not every person in your country living with a rare disease or every person working in rare disease, because they would be enormous. But to really kind of pick representatives of key organizations who can take the messages of these big structures like ERDERA, like ERDERA, and can transform those to people on the ground, but who can also reach out to people on the ground and bring that wider community in. So, for example, in the UK, we would have representatives of key research infrastructures, key research institutions, universities, hospitals. But we do have a sort of mandatory list of core stakeholders that all national mirror groups should involve. And patients is really important here, of course. So our strategy is to really insist that, where possible, a national alliance of rare disease patient organizations, which exists in most of our ERDERA countries, that alliance should be deeply involved in this organization. And mirror groups may want to bring in representatives from, some disease-specific organizations as well, where those people are really active at the kind of cross-rare disease level. So that's really important. And we're also really pushing as strongly as we can for mirror groups, not just to include all of the partners who are part of ERDERA in that country, that's really important, but also to think about what we call competent national authorities. So decision makers, policy makers, people from your ministries of research, of health, your departments of health, etc. If you can't bring those people in directly, then there should be a good link, because it's important, I think, for all of our countries that the national mirror groups, when they're launched, when they're set up, they don't just sit there as a kind of academic think tank. We really want there to be a route to actually influencing policy. So hopefully in future, more and more, getting the mirror groups involved in making sure that countries have a national plan or strategy for rare disease that's actually doing something. And really trying to force changes. And you can do that much easier if you have the key decision makers somehow involved in your structure. So moving forward, we're going to be looking at the organizations. We already have, across the first 18 national mirror groups, we have over 230 organizations globally who are kind of direct members of these groups. So, the pieces are in place. Now we have to start really mobilizing them and getting all of those actors talking together and not just talking to us in ERDERA.